So one of the things that helps decrease spasm is by breathing in different positions. So seated is one position where your belly fills first for the first third of the breath, then the chest fills, then you tuck your chin and lengthen your neck. So you maintain all that space and you exhale so that your diaphragm plunges the air out like a French press plunger moving up without you getting smaller. That just tells your brain, if you can find a pain-free position to sit and breathe, that this position is safe, I can breathe fully in this position. Then you want to progress. The hip flexor is shortened in this position, but when someone goes to stand up, now coming up, sometimes it takes a little bit, tucking the tail slightly, finding weight in the right heel, left heel, being upright now and breathing, belly, chest, neck. Maintaining all of that volume and space, exhaling in the belly. If you can do 5 to 10 breaths just standing in a balanced position at neutral, that's again, now I can stand without my brain being scared that I'm going to spasm. A little more challenging but important is for us to be able to walk comfortably, we have to have elongation or extension of our hip. So we'll bring a block onto the floor, and sometimes this is even too low. So I could even go higher and have the block vertical like this, in which case I'm kind of going to be lunging, but I want to make sure I have something to support me, or I have a chiropractor or someone with me to help me. I first go into my breathing. So belly, chest, neck, creating that space, exhaling and maintaining. On the next one, as I'm inhaling, I'm going to descend into this position, try to get my knee to that, elongating the quad and the hip flexor. So I'm here. I'm sending my hips back behind me. I'm not just dropping my knee. If I only drop my knee, I'll be anteriorly tilting my pelvis. So I'm actually going to be going in. I'll show you from the side so you can see it. Like that until I get my knee to the block. But I'm going to do it this way so you can see how I have my hand also. So I'm here. I'm inhaling, setting. Then as I inhale, hips go back, weight in my front heel, inhaling. Hand on here to make sure I have that stability. My hand here to stabilize. Once I'm here, I'm basically like in almost a deadlift position with this one leg. I'm going to start to not bring my chest up because that would extend my spine. I want to bring my pubic bone forward, my tailbone toward the floor. That same breathing, belly, chest, neck. Kind of walking myself up. If I get to the point where my body doesn't want to go further, I just stay as far as I can go up. I can stabilize. I can use my hands even to help create more space. I breathe, belly, chest, neck. Tucking the chin, holding that space, exhaling with the belly. Inhaling, creating space. Exhaling, maintaining all that volume. And you do this 5-10 breaths. Again, you're teaching your body that you can do a little bit of hip extension, that you can lengthen the quads slightly, you can stabilize the spine. To come out of it, stabilize on the leg, stabilize on the table, put weight in that front heel, and then as you go to stand, you're going to lift that opposite hand. So I'm using this, my lat connects to this glute, so I'm going to lengthen and inhale, so it's stabilize and open, let your body settle into it. Again, use some assistance or someone else if you need help. Otherwise, you would switch sides, 5 to 10 breaths. You continue to find different positions for your diaphragm, your low back, and your brain to work together to decrease some of the spasm, increase your movement, and get some of your movement and life back.